Okay, so you've sprained your knee and you're wondering, do I need an x-ray or do I need an MRI? Let me tell you a little bit about how we determine this, or what questions we ask patients when they come in with a sprained knee or with some knee pain, because this is a common question, or some people even just call us on the phone, okay? So the first thing that I want to know when someone is having some knee pain and whether or not they need further tests is, how did the sprain happen, okay? And so you have to know that an x-ray, first of all, is something that looks primarily at bone, okay? So when you get an x-ray, what they're looking for tends to be some sort of a damage to the bone, right? Is there a fracture, or is there even a stress fracture, or what they could call like a bone stress injury, which wouldn't necessarily even be a line in the bone, but something they can see in the bone. Now, most knee sprains don't happen with enough force to cause bone injury, right? So what I ask someone is like, how'd you sprain your knee? And if it's like, well, let's say I was just, working in my kitchen and somebody, I turned to get something like this and my foot kind of got stuck and I just twisted my knee a little bit. I mean, would you think that would cause bone damage, right? No, it wouldn't, right? So a lot of times you have to ask that question first. And what I'm looking for in the mechanism is, was there enough force, right, pushed on the bone, enough velocity, speed to cause injury to the bone, okay? So if you fell down some stairs, or let's say you had to jump off of something high, something like that, and you felt like a really sharp pain, yeah, then you probably do need an x-ray. But if it's not that, right, if it comes on just gradually, meaning like, yeah, I played a pickup basketball game and then the next day it was swollen, and I do remember sort of like having a little bit of an awkward turn while I was playing, or even just doing some yard work and your knee swells, then you probably don't need an x-ray, okay? It's not really gonna show anything other than you have a knee, and a lot of times on the x-ray it'll just show there's a little bit of wear and tear in the knee that's usually just based on how old you are, okay? So the answer to the question is, do I need an x-ray is, how did your knee sprain happen? If it doesn't involve enough force or velocity for there to be bone damage, then the answer is typically no, you do not need an x-ray. It's kind of a wasted visit, right? To see the orthopedic for that, in our opinion. Now, if you have ongoing knee pain and you go to see an orthopedic, they're going to do an x-ray every single time, right? So don't worry about that. That's just kind of their protocol, what they do to make sure they just cover all the bases. And there is value in going to see somebody like an orthopedic who will do an x-ray at a certain time when you have a knee sprain. But a lot of times this is why people come directly to physical therapists, right? They know they don't need an x-ray, so it's like, I didn't do anything. I know the bone's not broken. I know there's no damage to the bone. I just have a little bit of swelling discomfort. I'm going to come directly to see you. All right, so then the next question is, do I get an MRI? All right, now this one can be a little bit trickier because, again, there's a lot of factors that get involved in this, like again, the mechanism. What was the mechanism like? How long has the pain been going on? Has there been ongoing swelling and pain and discomfort that's been unrelenting, or has it been going up and down? So there's a lot of factors involved into when we recommend somebody get an MRI. Now, one of the areas where we do tell people probably right away to get an MRI is in sport type injuries where the foot is loaded and there is a hard twist, and usually people feel like something pop or give out, okay? And that is typical of a large ligament strain, right? So an example of this would be kind of a cutting injury, meaning like you plant, push off and cut like that, where the leg, there's a lot of force on the leg and then there's a twisting. Or if your foot is planted and someone in playing football and someone lands on your leg and it's caught in the grass and you kind of go down and there's a twist. Those are some of the more common mechanisms that happen, but it's usually involved in sports, and it's usually the person knows like something gave out, right? You know, that they feel that sensation of something giving or popping like that. And if someone comes in and that's their story, and we see swelling, not always a lot of swelling, but definitely some swelling and some pain and a feeling of unsteadiness, like something just doesn't feel right. I just don't feel like my knee's stable anymore. Then that's a lot of times where we would recommend an MRI right away, because there's a good chance that there's a large ligament tear in there, okay? Now, for other things, right, again, where it's just something like, yeah, I was just going up and down stairs a little bit, doing some yard work, you know, went for a long hike that was more uphill than I thought, and then my knee swelled up that day, and the next day it was still swollen. Do I need an MRI? Usually no, okay? And so this is the interesting thing about MRIs, right? If you get an MRI, chances are it will show something there, but a lot of the things that are findings in an MRI have been around for a long time. They just become symptomatic, okay? So the most common of these is findings on the MRI that have to do with the meniscus. The meniscus is the little padding that's sort of in between the knee, and these little these kind of circular shaped cartilage tissue, I don't know what you call them, like shock absorber type things, right, that are in the knee. And it's a wear item in a sense, right? Like, so a lot of times there is some pathology to that meniscus, meaning like there's some little tears or some fraying and things like that. And what happens is people are like, oh, my knee's swelled up, I better go in and get an MRI right away. They get an MRI, and the MRI is like, oh, there's a meniscus tear. And what they don't realize is that meniscus tear has been there for a very long time, sometimes years. And for whatever reason, your knee got inflamed, and the meniscus tear really isn't the cause of it. You get the inflammation down, and you just kind of go back to normal. So a lot of times, if it's something, again, where there isn't a twisted and loaded mechanism or a lot of force or velocity, then we tend not to recommend an MRI either. Meaning, and part of not recommending the MRI is like you can always just try conservative treatment first, meaning like just try doing some rest, some anti-inflammatory, some ice to get the inflammation down, then try to strengthen it and see if you can't get back. And then if for whatever reason it doesn't get better at all, then that may be the time that you would get an MRI. Now, MRIs and sometimes x-rays, but mostly MRIs, there's a little bit of a psychological trick, I think, with these, and which isn't good for most people. So recently, I had a guy come in, and he hurt his knee. He kind of had it was sort of like he was jumping up onto something, and he was pushing off of his knee, and he felt some pain, but not like his leg gave out or anything. And he immediately, the very next day, went to see the doctor and got an MRI right away. Now, the MRI did show like a fairly significant meniscus pain, but by the time meniscus damage, right, tear in there, but by the time that he came in to see me, his knee was actually feeling quite a bit better, right? He had full range of motion, his strength was good. He was a little bit hesitant to move around on it, but as we talked about it, some of those feelings of being hesitant as to what his knee was capable of is because of what he saw in the MRI. And I kind of asked him this, I'm like, you know, if you hadn't gotten the MRI, how would you feel about your knee now? Would you feel better? And he's like, I actually would, right? Like my knee I wouldn't be as worried about my knee if I hadn't have gotten the MRI or known that knowledge, right? So, and I told him too, I was like, if you came in here and I didn't know that you had an MRI and there was no findings, I wouldn't be sure that you had a meniscus tear, right? Like the way you're presenting right now, you actually have pretty good strength, pretty good range of motion and things like that. So a lot of times MRIs like I said before, rarely is there zero findings on an MRI. It'll show something, especially if you're someone, 35, 40 years or older, it's going to show something, especially if you're an active individual. But a lot of times what you read on there can almost put what we call like a thought virus in your head, and you're like, oh my word, I saw that thing in there. Oh, no wonder my knee's hurting. Whereas if you didn't even know that information, then you'd be more likely to kind of just stick with conservative care and, just keep getting stronger and head back out to activity. So that's just a little bit of information behind what the question we get regarding x-rays and MRI and whether or not you should get them. X-rays, it's a little bit more cut and dry. A lot of times whether or not you should get them. MRIs, not always as often, but for most things involving the knee, unless there was a dramatic type thing where you felt something pop and give out, then rarely is it a bad decision to wait a little bit longer, see with just some time, some physical therapy, if you can't get it better with conservative treatment. Then if it doesn't get better, if the swelling stays consistent, the pain stays consistent, every time you try to increase your activity, it comes back, that's more likely the time that you would choose to get an MRI. But for a lot of things in the knee, they tend to get better on their own, and physical therapists are great people to kind of help you get past it and just get back to that activity, and hopefully without a lot of restrictions and getting back to 100%. So a little bit more complex subject. If you do have any questions, I'd be happy to see when I have some time answer some of them, but hopefully that gives you some insight into that very common question when it comes to a sprained knee.